Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.
For those consumers who work at a company that offers insurance benefits, it's important for you to pay attention to what you are signing up for each year. Some plans that have been in existence for years may now be changing or not being offered anymore. So during this open enrollment period, it is wise to review all of your policies that are available to you. Now, Jordan, I'm going to get you into this conversation now. So, you know, this year, a lot of people are noticing that their plans are changing. Is this something that's new, or has this been going on like through the years and you just didn't notice it until now?
Plans are certainly changing. I would say that it's been ongoing. Those that are noticing some of the significant changes might be a result of more out-of-pocket costs. And so one of the things that consistently comes up with employer coverage is that balance between what will the employer pay and then what will the employee and the family be responsible for. And so we're seeing a shift in some of that cost more towards employees. And if they haven't seen that before, this is a likely change for them to see in 2017. Also pharmacy, there's going to be a number of changes for prescriptions. And so when people are looking at the cost of care, it's not just going to the doctor, but also how they're going to pay for that, for the prescription that they're going to get after that visit. And so for them to look at the specifics of the plan, to talk to an HR manager, to talk to somebody that's providing that education is very important, because it'll help them understand their cost up front and then ongoing throughout the year.
Now, as consumers go into these plans, what should they take into account? Because you've mentioned some things already, but if you had to really point out major keys that consumers need to take into account when choosing their plan, and especially when it comes to the overall cost of the plan, what should they be considering?
So many employers have a couple different options. And so they'll have maybe a base plan that's a high deductible plan. And what that really means is that the employee and their family will pay more up front when they receive care. And so when they go to the doctor, it's not just a copay, a $25 copay or something like that. They'll be paying possibly a couple $100s to see the physician up front. But then after they spend up to that deductible limit, that's when the plan starts taking on more of those expenses. And so there are really two different types of plans, and consumers need to know whether they're in a high deductible plan or a copay plan. And sometimes you can pay a little bit more in monthly premium and buy up to that copay plan. And so for them, that's probably going to be the biggest determinant in their out-of-pocket costs, and that will help them plan the financial impact for the coming year.
Which you're sort of touching on my next question, because what is the difference, say, between a normal PPO plan and a consumer-directed health insurance plan?
Sure, and so the PPO plan really is going to be one that's based on that copay structure. And so you go to the doctor, or you go and you have a generic drug, and you kind of have that fixed small amount that you pay for each of those services or each of those prescriptions. The high deductible plan, the patient really is paying the cost of that care. And so one of the things that's good about that is for those who think that they might have lower costs, that's one way for them to pay lower premiums and then just pay for the care that they actually need. So that could be a good way for people to control their costs that way. Also, it's good because people actually see the cost of care, and people can make more informed decisions about where they receive the care.
Mary, go ahead.
I was just going to add, I think another thing important for consumers to think about is some of the things Sorian mentioned were your plans, your drugs. Are you on a lot of medications? Is your physician in the network? But also, how do you use services? Do you have a chronic condition where you think you may need to go more frequently? So back to the deductible plans and whether that out-of-pocket is important for you and your family is, are you going more frequently than, say, someone who doesn't need that type of frequent visit? So that's really important to act early, get assistance, and really plan for what you need ahead of when you need it.
Mary, anything to add to that?
I completely agree with everything that everyone has said. I think in the individual market, as Jordan pointed out, since employers contribute to plans, the employee choices are more limited than in the marketplace available at healthcare.gov and on our site. But those individuals, I would encourage to really spend some time thinking about how they utilize their health care, where they go to the doctor. We're lowering copays all over across the board on our individual plans. So we encourage people to go proactively have that visit and better coordinate their care. Certainly want to look at the premiums and the out-of-pocket costs. So both of those are key pieces.
And in talking about, say, the private exchange, are there any options on the private exchange for health insurance coverage?
For Blue Cross, we're offering the same plans to individuals both on and off the exchange. So if they come directly to our site or go to healthcare.gov, they will see the same set of options. The difference being that on healthcare.gov, they can access financial assistance from the federal government, so they can access help with their premiums and or help with their cost sharing, so the member responsibility of the plan. Sometimes some people within certain income ranges qualify for additional assistance.
As you go through the year, sometimes things change. Are you able to make changes in your plan throughout the year?
You are. Certain changes are a qualifying life event that entitles a person to a special enrollment period outside of the open enrollment period. There's a list of almost a dozen of them. I'd encourage people to review that list, but some of them are, for example, a permanent move to a new service area where different plans are available or your plan may no longer be available, or a marriage that qualifies you for a special enrollment period as well.
So I would add, within the context of an employer plan as well, it's very important if you have a kid and you want to add your new baby to the plan to make those kinds of updates throughout the year as well.
Health Insurance Open Enrollment Get Answers is a production of UNC-TV in association with the North Carolina Hospital Association.